destructive worldwide, and it's been very challenging, both socially, politically, economically. It's affected every area of our life. Obviously, we're doing all of this on Zoom as opposed to potentially being in person. And what we also learned through this is that current infrastructure and, more importantly, current data sets are nowhere near where they need to be. And so, how can we use technology to make data-driven decisions to ultimately have better outcomes, both from a health perspective, a social perspective, and an economic perspective? And when I was approached to give this talk, it was somewhat challenging in terms of how to frame all of the things that we've done. And so, what I've tried to do is timeline the structure out based upon the last 13 months and how we were working basically hand in glove with the state of New Mexico, primarily with the Department of Health, along with the governor's office, to develop tools in real time that would empower their response, that would give them the data necessary to um, have an effective response to COVID. And so I've broken this out into really two themes. In the beginning, it was all about testing. So that's what the first half of the talk is going to be about, and our testing efforts and what we did to try and use technology to support our testing efforts. And then vaccine, and how we've been using mapping software really as the key to making New Mexico incredibly successful in the nation in terms of its rollout. So if you have any questions throughout the process, please jot them down. Um, and I hold the keys to the kingdom. So you're only seeing partial screenshots. If you actually want to see the applications working or anything like that, we can obviously pull those up in the Q&A. So that's essentially how the talk is framed. We're going to first look at COVID testing, and then we'll look at COVID vaccines. So let me go ahead and go to the next slide. So COVID testing. So for us, for real-time solutions, this all started um, in February of 2020. I grabbed this photo from my Instagram. I don't think at this point anybody really knew um, the effect that COVID was going to have internationally. I certainly had no idea. We were reached out to by Mari Annixter, who was the public information officer for the Department of Health, and she asked us to build a microsite for the COVID-19 virus. And she essentially wanted a centralized site for all information regarding COVID-19. This would be information for providers, information for the public, labs, and just keep in mind, back February of 2020, nobody really knew a whole lot about this stuff. We were learning as we were going, and you'll hear me use this phrase quite a bit. We were building the ship as we were sailing it. And what we quickly realized is that in the beginning, it was all about testing, 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 testing. And this provided a number of operational challenges given the current infrastructure that the Department of Health currently had. For example, just taking a walk down memory lane and kind of thinking through some of the problems that our solutions needed to address were, where are these testing sites located? How many tests are being performed at each location? When they're performing these tests, are they running out? Are our partners and our providers running out of test kits or PPE? How do we organize surveillance testing so that if certain spikes happen in a particular community, how can we operationalize and mobilize testing units within that community? And how do we report all of these testing numbers back to the public? Now, this framework was not given to us up front. It wasn't like, oh, here's the bullet list of functional specifications that we need. We need a solution that would do this. It was ultimately a partnership that we formed with the Department of Health that these really task orders here became apparent. And the solution, the overall solution that came about, was the New Mexico Department of Health Provider Portal. This provider portal went live at the end of March, and it was essentially a data gathering tool, really focused on centralizing an intake of the data, because at the time, all of our providers all over the state, some were reporting in their EHRs, some were reporting directly to the state, and data was everywhere, and data was a real problem in the early stages of this thing. So the view given to us, or the need given to us by the Secretary of Health at the time, was to create a provider portal that we could centralize the data intake. And then ultimately, the Department of Health could use that data to make operational decisions and minimize the impact of the virus. Also, it gave us better reporting numbers to the public so that we could track our progress. We could see where the virus was spiking in certain areas of the state. And from the department's perspective, go and try and minimize any damage as a result. So the provider portal has grown into a very large tool. I'm only going to focus primarily on the GIS features of this tool, just to really focus in our talk and make sure that we spend the majority of our time on the mapping software. So the first thing that we needed to do was organize our providers and really understand where testing was happening throughout the state and what the details of those tests would be. So you can see we built a structure here for testing site providers that was parent-child categorical. So you have a parent, and then the parent could have multiple children. So Presbyterian Clinic A, Presbyterian Clinic B, Presbyterian Clinic C, and essentially they had two things that they needed to do in the portal, and we tried to keep it as streamlined and as simple as possible. They needed to create their testing site profile, which included what type of test this was. Is it a drive-through? Is it a walk-in? Is it an emergency department? What kind of category this test site was? Is it public health? Is it a private partner? Is it surveillance testing? Ultimately, the Fed came in and helped with some testing. What is the site's address, hours, and contact information, the dates and times they're open, along with what labs are they reporting? Based upon all of this information, we were able to drive the public testing location directory that New Mexicans use to essentially find testing sites within their location, and then ultimately schedule an appointment through the further information the provider made available, which is still live and being used today. Early on, we tried to manage this ourselves, and it became very clear that the amount of data coming in and the shifting nature of scheduling and the shifting nature of these public locations became very, very challenging. So what the provider portal did was it empowered the providers to keep their location details up to date, their hours of operation up to date, their scheduling up to date, all of that information, so that the directory that's being fed is ultimately the information that they're managing on the back end. So each provider has a username and login in which they go in and modify the directory as needed. The mapping feature here is really a simplistic, really a very simple implementation of some of our GIS capabilities. Essentially, it's geocode all of those locations, plot them on a map, and then feed in from a database the different information that they're entering into the form. Very, very straightforward, very simple. We obviously were using Esri's base maps along with a presentation layer for Leaflet was our presentation layer, which is a JavaScript-based presentation layer. What happened here was it immediately made the public aware of testing sites in their location. And the reason I think that this is important is other states were standing up different solutions and whatnot. But when you look at data and how individuals consume it, there's times where maps make sense, and then there's times where maps really don't make sense. In this instance, it was very clear that if we just had a tabular presentation of the data, it would be really hard for 75-year-old grandma in Grants to try and find where she could go. Whereas with a map, you can zero in on your location, click the information, and get the contact information and go quickly. So this public testing location directory pulls all of its information from the provider portal, making it easy to connect the public with providers that are doing the testing. In addition, providers were required to report on their daily testing and lab reporting. So how many people they swabbed, how many kits they had remaining, and what labs were processing the tests. And the reason for that is, if you remember, in April and May, there was a real shortage of test kits. There was a real shortage of PPE. The Department of Homeland Security and Emergency Management was really tasked with making sure that there was an even distribution of all of that, but we really needed the data to understand which locations were, getting ready to running out of tests or swabs, so that we could activate or deactivate their directory listing till we got them more supply. So it was really trying to help with the supply chain here, as well as, if you remember, some of the labs were being overrun early on. And so, Tricor and the state lab they were incredible in these early days, processing thousands and thousands and thousands of records. But as the testing grew, I think at the height we were at 17,000 tests a day, which is pretty incredible. The backlog at the lab, it would take 5, 6, 7, sometimes 14 days for the individual to get the result. And if you talk to any epidemiologist, by then that person has spread it to a number of people. And so what this data gave us was a little bit of insight in terms of projecting out, okay, this lab is almost at its capacity. How can we communicate with the provider to either work with a new lab, or how do we get additional labs in here to process the swabs? Department of Health was in charge of all of that. We were just giving them the tools to collect good data so that they could make good decisions. So on that, DOH operationalized all of that testing data. This is basically the dashboard that they see when they log into their provider portal. You can see basically a heat map over here on the right side of where all of the testing is happening throughout the state. You can see down here are the actual providers that are still doing the testings and that are active. All of this data also feeds multiple government dashboards, including the directory, which we'll see here in a second. But essentially everything that these providers were logging into the system, we were helping the department visualize so that they could see where the hotspots were happening and whether or not those testing was happening. So just a basic scenario to bring a little bit of clarity to that operational challenge. If COVID was breaking out in a particular community or a county or something like that, and we looked at the testing numbers within that particular county, there was a concerted effort made on the part of really a multi-agency approach to get testing increased there, something called surveillance testing. So through the provider portal, we organized surveillance testing. So essentially this was a tool that multiple agencies, aging and long-term services, PED, the big one, environment, with all the businesses and restaurants, they could come in here and request testing to be done at a particular business. Those tests were then, they would say, location A has 100 employees that need to be tested because there was an outbreak at such and such location. DOH would review those requests that came in and then make a decision on whether to approve those tests. And if they were approved, they were entered onto the calendar as well as plotted onto the map so that DOH could start working with multiple providers within those areas to do the testing, whether they needed to go to that location or have those employees come to their location. The tool really gave them a location-based view in terms of how we can use this data to coordinate with our participating partners. Hopefully that makes sense. If you want me to talk a little bit more about surveillance testing, I can do that. But this is one instance in which the Department of Health is using the data to really operationalize their response to COVID. In addition, the Department of Health reports the data daily, and I'm sure most of you have seen this tool. This is the tool that we stood up in, like, I think 6 hours. We got a call from the governor's office. I won't go into that. That was a very, very stressful 6 hours. We got it up, and it's taken on multiple iterations. Right now, it's displaying the red to green to turquoise framework, but it essentially is reporting all of the COVID cases and tests. It's got historical statewide data, including the epi curves, demographic data down to the county and state level, along with integrated census data so that we can determine positivity rates and cases per 100,000 in the population. So once again, making sure that we have good data as our base, we can build upon strategies moving forward. I will also mention that within the provider portal, this update data is where the Department of Health goes each day to update all of the different cases per county, all of the different demographic information in terms of male, female, age, race, gender, all of those necessary things. And then once they upload that data through a batch upload, we parse it and present it here on the map. That's once again an Esri base with a leaflet presentation layer. So from a testing perspective, the provider portal really served as a centralized data repository for our providers to come in and report the testing that was going on, the shortages in PPE that they were facing, and it really gave the Department of Health a lot of information in terms of how they should, how and where they should be doing surveillance testing and upping testing, mobile testing units all across the state. So that's essentially an overview of the tool sets that are focused primarily on the mapping software that are involved in the testing provider portal. As the timeline continued, it was obvious that the vaccine was the end game here. Testing was really the mantra while we tried to figure out, and we collective human species trying to figure out how we can really bring this virus under control. And it became very evident that the vaccine was the end game. And so in the fall, the Department of Health started planning the vaccine rollout. And as a result, we were working hand in glove with the Department of Health to develop a tool to determine where and how the vaccines were going to be distributed, giving the criteria. And the challenges here was we had limited supply, right? And the first tranche of vaccines were to go to the healthcare providers. Now, at the time, the federal government was working on a tool called Tiberius through Operation Warp Speed, which is still being used today for vaccine allocation and allotment. But in these early stages, the ship was being built as we sailed. And that's not just with real time, that was at the federal government as well. And so the tool in its early stages was very clunky, it would break a lot. And so what the Department of Health asked us to do was help have a very specific New Mexico focused a tool that we could look at a number of different data sets, look at which healthcare providers were going to be receiving the first allotments of vaccine, and the best way to communicate all of that in our viewpoint was through a map. We worked with Dr. Aja Senzoni, who was the medical director for the Infectious Disease Bureau or the immunization team, I can't remember, at the Department of Health. And we worked with her in order to bring in multiple sources of this data to the base level so that we could really start planning out the first rollout of the vaccine. And so the challenge was that we had, I think in that first tranche, only 19,500 vaccines coming to us. And so we had to figure out how do we equitably distribute 19,500 vaccines that first week. And it was the audience was defined, it was going to healthcare providers. So bringing in census data, the Department of Health put out multiple surveys to our providers so that we could begin to understand how many workers that they had, so that if we had to move to a percentage base system, we could, all the provider location, as well as testing data, positivity rates, those kind of things we're taking into consideration when creating this plan. And all of those were included in the base layer here. I've just turned on total healthcare staff, but this has census data, long-term care facility data, just a whole host of base level data. And then what Dr. Senzoni could do is start turning on, based upon, different needs within the county, she could start turning on different facilities to start getting an idea of whether or not she could send vaccine to them directly, or if it needed to come to the Department of Health and then out to them. So the tool that we helped for the first tranche was basically a tool that brought in all the providers that had formed an agreement with the CDC and the New Mexico immunization program, had those agreements approved and had ultra cold storage in order to keep these vaccines. And we needed to give Dr. Sanzoni the ability to create multiple scenarios based upon direction she was getting from leadership, as well as direction that she was getting from the federal government and a whole host of other players. But essentially, it broke down into two scenarios in which hospitals with cold storage, like your Presbyterians, UNMs, received a direct shipment of that first tranche, and then everything else came to the Department of Health. I think they called it the Department of Health drug warehouse, which was then spoked out to these public health offices and additional partners that had their agreements in place. I believe the first week the vaccine rolled out, we had 27 partners that had their agreements in place, something like that. And now we have over 400 that are actively distributing vaccine. So those were the two scenarios. The hospitals would receive their own, and then they would allocate it to their clinics, and the Department of Health warehouse would receive it and then distribute it out. So the tool really just created a relationship between the parent and the child, right? So anytime you created a distribution, you can see down here in the hubs, Christus St. Vincent would get 975, and that spoke would be created. So anytime you created a new hub, the arrow showing where it was going would be approved. So this gave the administration, this gave the a lot of the key stakeholders a good visual to show that that first tranche was really being equitably distributed. And it would be really hard to look at this information on a spreadsheet and be like, oh, okay, yeah, we're, regionally we're doing okay. Visually it's obvious that the Department of Health did everything within their power to make sure that it was an equitable distribution for that first tranche, and continue to do that throughout the vaccine rollout. So those are two of the tools that we helped the department with the planning of the vaccine rollout. The next tool that I'll show you is how we are actually helping with the distribution of the vaccine. So we were approached by the Department of Health. And Sandeep, just to be safe here, am I doing okay on time?
Yes, you are. Go ahead.
Okay. So we were reached out to help in early December to build the vaccine registration tool. Essentially, the department and the governor's office wanted a tool that would serve, once again, as a centralized system for the public, for providers, and for the department to be able to make operational decisions again. But when you're planning this, it all sounds great, but some of the operational challenges that are still fresh in my mind, because we've been doing this now for about 4.5 months, was one, how do we get the public to register, and what do we do? What kind of data do we need to collect? This is all PHI, so how do we make sure that the data is protected and we're not revealing any HIPAA violations or anything like that? How do we get providers to use the system? Providers have their own EHRs, their own EMRs that they're already integrated with NMSIS. So how do we get providers to jump onto this thing? How do we connect registrants to providers that have vaccine without creating a rush on these locations? Because I don't think the nation really understood the run on vaccine locations that was about to occur for the next 2 months, based upon the immense amount of need and the low amount of supply. And so we didn't realize that that was a task order, but it quickly became a task order. And then lastly, how do we report and monitor all of this progress? And so the first thing that anybody has to do if they're a member of the public and wanting to use the registration system to get a vaccine is they have to create a profile. And the profile, we broke it out into two simplistic forms. And we really asked, what's the minimum need of information that we need to gather? What's the minimum amount of data that we need to gather in order to connect these groups with vaccine providers? And so it's really basic personal information, first and last name, The date of birth tells us how old they are. The zip code tells us essentially where they live. Preferred language tells us how to send them notifications in English or Spanish. Excuse me. The contact method, our system sends emails, sends text messages, does automated phone calls. Employment information as well as chronic medical conditions, along with zip code and date of birth, were all necessary data sets in order to determine an individual's phasing criteria, whether or not they fell within a particular phase. In New Mexico, our administration was very, very vigilant in terms of making sure that we tried to stay within the phasing criteria as much as possible. And the registration tool allowed us to do that because ultimately appointments were locked down to a particular code. And I wish I could say that everything happened, it was all hunky-dory with zero problems. We've had challenges. In the beginning, I remember everybody and their mother were sharing location codes, which was a good lesson to me in terms of humanity and remembering that people choose survival over everything else. So we had to lock down the codes. We had, when we originally rolled out this form, DOH did not include the chronic medical conditions. So we had to include those and then send out a text message to 220,000 people that had signed up without including their chronic medical conditions. There were absolutely bumps along the way, but the tool at the end of the day has served New Mexico very well and has led us to be a leader, and we'll get to that in a second. So the public has to fill out a profile, and then what the Department of Health does is they log in and they can visualize basically the registrant data, where are the concentrations of registrants within our state. Now, obviously, viewing this with a heat map kind of shows us the population centers we would expect: Bernalillo, Santa Fe, Doña Ana County. But what's really encouraging is that you'll see in all of our little rural communities, you're really getting some pretty intense heat centers, which means rural New Mexico is adopting the registration tool as well. The Department of Health on the left-hand side, you can see they can view this data by phasing criteria. We also cluster the information so we can see the actual numbers of registrants throughout the state. And then with a whole host of filters, you can really report down to the, a pretty granular level, how many registrants per zip code. And what this has done is this has led to a number of really helpful insights. We know where we need to turn the marketing up for registrations in counties that are low in terms of their registration reports. We also know that if we have low registration reports, perhaps we need to plan walk-up events in those areas in order to move their location to community immunity quickly. But essentially, you can filter down by phase, zip codes, how many notifications have been received, and we'll get into that in a second. The vaccination status, so how many people have received their initial dose, how many are fully vaccinated, how many have scheduled their first appointment, that kind of information. Also, chronic medical conditions. This was monumentally helpful to the Department of Health while they were trying to determine, do we move to the next phase? Do we move to the next phase? And it's a constant shift, right? As people register, notifications go out, and those schedules are made, and those appointments are made, and we need to keep feeding coal to the engine, is the way that I view it. And so this data gives us some really good insight in terms of where those registrations are taking place. It also allows the Department of Health to see all of the providers that are currently using the system to administer vaccine in the map. And so the thing that New Mexico did that really set it apart was our providers in New Mexico are incredible. They're just flat out incredible. The majority, high 80% of all providers that are administering vaccine are using our portal to administer vaccine. And so you can see all of them are mapped out. And what we did was we color coded these locations. So these are all providers that their event schedules are full. The yellow pins are providers that have 75% or greater full. And then Orange are ones that are 75% or less appointments are full. So a provider basically logs into the system and they have their own profile, and they, through a calendaring tool, can create availability within our system. So this is Expo New Mexico, Department of Health. They created 1,500 people, a 1,500 person event on the 19th, a 1,400 person event on the 20th. And then through our Fill My Event feature, they can request the Department of Health operations team to notify registrants of that availability through a text message or an email. So what happens is the Department of Health, oh, missing a slide. The Department of Health, and I'll just go ahead and show it to you guys here. Sorry about that. So this is the tool in real time. The Department of Health can use a particular location that they receive a Fill My Event request, select that location, and that location's information comes up. So if the operations team wanted to see what their calendar looks like, they can see basically all of the things that this provider is requesting. Notifications can be sent out via county, via radius, or via zip code. So if we did a radius and we just said, okay, people within a 3-mile radius of this particular location, please send out 500 notifications to the filtered audience. There would be a code that would be created and they would click submit. People would receive a code via text message and or email, and then they would be able to schedule an appointment based upon the availability that the provider has set in their calendar. Does that make sense, everybody? Hope so. If you have questions about this, we can definitely talk about all of this fun stuff in the Q&A portion. Lastly, let me get back here. Lastly, how does the Department of Health report on all of this data? So not only are providers using it to calendar, but if you use our system to calendar, you also have to record or document in our system. So at the end of each day, our system reports to the state of New Mexico all the vaccines that took place across the state that the providers have recorded. The state of New Mexico then scrubs that data and pushes that data to the CDC's data lake for national reporting purposes. And then additionally, the state of New Mexico uses the registration data to report on vaccination progress on the public dashboard of vaccine NM.org. There's a whole host of different data layers that you can see broken down by population, number of residents fully vaccinated, individuals that have received their first shot. Within the dashboard, it was challenging. The data is always challenging, right? So what the Department of Health decided to do was have a vaccine registration specific dashboard, which you can access by clicking the link here. And then this is essentially everything that's reported from NMSIS. So those 12% of providers that are reporting their own vaccines through their own system and doing their own outreach to get people vaccinated. It includes all of that information on this public dashboard. And then the registration dashboard is only the vaccinations that are happening within our app. So I'm hoping you see why I tried to do a timeline in terms of explaining all of the different mapping tools that we've been using to try and address some of these things. And I hope I communicated effectively how the Department of Health is using a lot of this data to operationalize their response to COVID-19. If there's any questions, I'm absolutely willing to address them and answer them to the best of my abilities, or direct you to somebody who's got that answer.
I have a question.
Sure.
I was wondering, has your company been approached by any other states for assistance in kind of, helping other places maybe build a similar type of tool?
Yeah, absolutely. We've spoken with Nevada, Ohio, New Jersey, some counties in Texas, and I think this all happened in 4 months. I mean, everything you're seeing on the vaccine side of things happened very, very quickly. And I, we're a small New Mexico company. We have 60 people that work for us, but our technical team is right around 14, 15 developers. And so expanding into other states, we realized very quickly that we would be spread very thin and we couldn't hire up fast enough to handle the load. So what we did was we just started sharing our slide deck with folks and letting them know that if they wanted to reach out to us for best practices or anything that we've learned, we would be willing to have that conversation with them, in terms of really getting this vaccine moving.
Thank you.
Mm-hmm.
There was a question in the chat just from Tamara Taylor. Just curious, did you consider some different shading, perhaps a hatching on the red to green map to help distinguish the green from the turquoise color?
Yes. I can't tell you how many iterations of color schemes we went through on that red to green to turquoise. When they put in turquoise, it was just like, here we go. Dan Sawson over at the Department of Health, I believe he's with ERD, I might be wrong there, was really, really vigilant to make sure that it was visually different enough, but you have green and turquoise, which are essentially in the same family. So it's very hard to do you go aqua. So ultimately, Department of Health, after our fourth meeting, solidified on the color schemes that you currently see out there. And I should say, I got to give a shout out to Todd. I meant to say this in my presentation when we took the zip code data live on the public directory, and that was a bear in and of itself because of some of these counties have minimal residents, and with all the demographic information that was being shared, you could potentially figure out who had COVID. So there was a lot of back and forth, but the decision was ultimately made to make the zip code data available. And when we turned it live and they did the news conference, we crashed Esri's service in the Southwest region. Todd put me in contact with his contact up in Denver, and they were able to bring it back online in like 30 minutes. But it just shows you the immense amount of eyeballs that were constantly on that dashboard. I think we were averaging like almost 1 million views a day. So Todd, I don't know if I've ever thanked you, but you saved the day on that one.
No problem. That was all Mike Walk, man. I was wondering about the testing site locators. Do you guys, because as I see it, like the more people that are getting tested, the more relative negatives you have. So the more, the better it can get, especially for places like us where the system isn't weighted for overall population.
Mm-hmm.
Do you guys have a plan to roll out like a mobile friendly testing site locator? I know there's like similar ones that Esri has put together, and we can shoot you examples too of stuff that you can use the cell phone location to pop like a 3-mile radius for people who are out and about. That would be
awesome. I'd love to take a look at it. The focus of Department of Health remains on both testing and vaccine, but they obviously what we're seeing within the nation, but also within our state, is our testing numbers are just really, really dropping because people are assuming if they get the vaccine, everything's safe. I mean, there's a whole host of reasons that's happening, but the testing is going to be around for a long time. So if we can enhance that solution, yeah, we would absolutely love to partner and see what there is.
I have a follow-up question too.
Sure.
Are you guys planning on making like a repository or some public access to the APIs so that the data can be called back from some of the other things that you're doing, like how much testing is being done? So I know like doing the doing the leaflet with the Esri base map doesn't give us quite as much visibility into like REST API.
Sure.
The plug directly into ArcGIS online applications, but we can doctor up some of the JSON stuff that comes out of your guys' systems. Is there any future possibility to having more access for state agencies on that front?
Yeah, absolutely. We do have, do you have access to the two endpoints for the public directory?
Yeah, we're consuming the county stuff and we're consuming the tests, but we don't have, I think, the anything about vaccine rollout and anything about the thing, I'm drawing a blank. The historical data for doing any type of like
Sure.
graphing over time.
Yeah, so we can take, so I'll have to talk with the dev team. I think we have a solution for the historical data that we integrated into a Salesforce dashboard for the Govs team. So as soon as I figure out what that is, I'll forward you that solution, but we can absolutely talk with Terry Reeser and all those folks about, making, the API a little bit more robust. Right now, there is not an API for the vaccine data, just simply because the the reporting features on that dashboard are constantly shifting and changing. And so we're trying to solidify that before we, build out the API and have to shift things around. So hopefully that's coming, as we haven't really had a whole host of changes in the last week or so, but I'm sure that will change next week.
Cool. Well, it was really good working with you guys in the beginning and trying to take a crack at it from the Esri side, and it really came out nice what you guys did. So good work on it, and thanks for your work.
I appreciate that. Yeah, and we do a lot of work with DOT, and looking forward to working with you a little bit more on NM Roads and getting that guy up and running and making it the best ATIS in the nation, man.
Really good. Actually, I have a quick question in terms like looking at the data. Just out of my curiosity, I was one of the slides that you were showing where the heat map was. There was, I believe, testing sites or the results of the. Okay, the screened. Yeah, so I don't see any data near Farmington Gallup area. Is it just because not enough data records to show a heat map, or just there's
multiple reasons. IHS is doing the majority of the outreach up there for both testing and vaccines. And we should also say that providers through the current public health order are required to report their testing numbers here. But I think Shelley reported that it was, a 70% compliance rate with that.
Okay.
So it could be a number of things. One, there's not enough data to have any concentrations up there, or two, IHS is doing their own testing up there and not reporting those numbers to us, and or they're reporting those numbers to us through ERD, and then they make their way onto the dashboard via the update data here.
Okay.
So that's ultimately what would be happening.
So IHS or Navajo, do they have their own separate thing as well, or this is it for their?
Can you say that again?
For IHS and Navajo Nation, like, is this the portal they will, or do they maintain a separate portal as well?
Yeah, IHS has their own tool that they're using, and members of the Navajo Nation really have been using both. In terms of the vaccine rollout, but IHS has done an incredible job, specifically on the Navajo Nation, moving those numbers pretty incredibly. And what we see is, our non-IHS providers like Rehoboth, McKinley, there's not a whole lot of demand in those areas, because most folks aren't registering on the state's tool because they've got their vaccine through IHS. So it poses some challenges, but at the end of the day, the goal is to get as many folks in New Mexico vaccinated as possible using whatever means necessary. And so we're incredibly grateful. And I think I speak on behalf of the Department of Health. I, Chris Schroeder, am super grateful for all of IHS's work out there.
Okay, one other quick question, and then we have a question in the chat. So this, I think it goes to Todd, because the NM testing sites located, the link that you shared, Todd, I don't see any testing sites in Clayton area. So is it just not, there's no testing site there, or it's just the
I'm sorry, what was that? I got pulled in another thing on the other screen.
sorry. In the map that you shared in the chat, the testing sites locator, I don't see any data near Clayton, Union County area.
Yeah, so the data that's on there is the stuff that's being pulled off of the REST endpoint for testing sites. So that's the stuff that's available coming from I guess what it's the what was
Provider portal, the provider
yeah,
portal for sure.
the provider portal. So we just essentially took the JSON export and created an Esri layer from it.
Okay.
And left the default table stuff on there, but it's the benefit I think is the ability to search by location there on the right side. If you pop the little that guy, yeah, it'll give you the cell phone's location.
Right.
So
yeah, that's interesting. Just I mean, I do see Raton and even Roy, but not Clayton. So just curiosity. So there was a question in the chat from Natalie. What Esri licensing model for the provider user accounts? Tech for automated notification by phone or text?
The licensing model, I have to ask the deputy CTO what license this was under, and then for the service for text messaging, we use Twilio, and then for emails, we use Amazon Web Services, and all of this is hosted on Amazon's cloud. On their government cloud, we utilize S3, we utilize Beanstalk, we're using CloudFront for a lot of the HTML, CSS, in order to handle the scale and the spikes in traffic. Early on, when the governor would send those emergency alerts to go to like newmexico.gov or cv.nmhealth.org, we would get like 400,000 visits within 15 minutes. And we had to have a scalable solution so that nothing crashed. And we just took that same architecture and applied it to these solutions here.
Great, thank you. Any other questions?
Woohoo! The 16-year-old's getting her vaccine today. That's awesome. You know, I got my second vaccine yesterday, and I'm not gonna lie, I'm feeling it. They said, you know, you'll have, you know, body aches, that kind of stuff. Yep, I do. So I apologize if that came through a little bit in the presentation, but very, very grateful for the opportunity to share the work that we've done that we're incredibly proud of, and that's really helped New Mexico speed towards community immunity. That's what it's about. And I got Pfizer.
Well, thanks so much for a really great presentation. It was very interesting to hear the behind the scenes of how this came together.
Yeah, and thank you very much for the opportunity to speak with you all. Yeah, we look forward to hearing more from this group, and potentially even being a part of it if possible. So.
Oh, great, thank you, Chris. Yeah, this is really a great tool and great presentation. So I guess if you don't, I was just looking at the chat. not necessarily questions. So I guess we can move on to the raffle. So we have two raffle items for today. One is a book, which is, as Carol is showing in the screen. One is switching from ArcMap to ArcPro, and the other is WebGIS. So you can pick a choice. The winner can pick which of it they want. And then the other raffle item is a $25 REI gift card. So
All right.
book. So all the participant list was taken and put it in an Excel, and those numbers are ran through a random number generator, and that's how we are picking those winners. So we do that, and the first winner for the book is Acacia Allen. And I do see Acacia in the participant list. If you could share your email with me, that would, or you can email me as well if that's okay. And moving on to our next item for raffle is Larry Brockman, $25 REI gift card. Congratulations to you both. Acacia, when you email, do let me know which book you would like. And if you could send us your shipping address, we'll ship it to you. And Larry, I do have your contact. I will reach out to you. All right, everyone. We still have 5 minutes. If any questions for Chris, if not, we'll call it a day and we'll meet next week.
Actually, I'll ask one more question. Are you guys collecting any statistics on like how many people who are getting either testing or vaccinations are using the portal to get these sites? I mean, to get to the, the appointments or the, testing sites.
Yeah. So let me just for the testing, no. And that's the difference between having a centralized coordinated system where the majority of folks are using it, as opposed to just a directory that sends everybody, somewhere. In terms of the vaccine, what you can see is each provider has, where am I? I just want to get in here, make sure no PHI is shared before I share the screen. Okay, so this once again is Expo New Mexico. And you can see they've administered 51,000 vaccines, averaging 394 a day. And you can see basically how they're doing that over time. We also break it down, and they can download this data at any time, what their upcoming appointments look like, and then the attendance, how many people are presenting, how many are rescheduling, how many cancellations, how many no-shows, and then making sure that their boosters match their primary. So they have some data visualization in terms of how each site is performing. So like if we wanted to look at UNM is kicking butt. 75,000 vaccines, averaging 763 a day. What we're seeing is about an 8 to 12% reschedule rate and a 5 to 10% cancellation rate right now. But as we open up scheduling, we're removing the code barrier on Monday. I'm sure we're going to see that cancellation and rescheduling number go up because people are going to have choice.
So what was the tool or interface that you used for this part of the graphics or the stats, Chris?
I believe it's a tool called HiCharts.
Okay.
It's an open source charting tool.
Okay. Looks much better than the SV charts. All right, thank you very much. Thank you all for joining, and thank you, Chris, for a wonderful talk. We'll see you all next Thursday for our last presentation on online georeferencing API, presented by Hayes Barrett, one of our colleagues at the Earth Data Analysis Center at the University of New Mexico. All right, everyone, have a good
Awesome.
afternoon and good day.
Thank you very much.
Bye, everybody.
Ciao.